Hi, everyone, and welcome to this talk about turning your doctor into an ally, teaching healthcare professionals about ableism and disability medicine. I'm Dr. Stephanie Van. I'm a Vietnamese woman with long dark hair, wearing a gray fleece, sitting in front of a colorful bookshelf. I'm an assistant professor at the Johns Hopkins School of Medicine, and I'm an interventional pain specialist in the Department of Physical Medicine and Rehabilitation. Joining us is my co-speaker and producer, Ajani A.J. Murray.
Hi, Dr. Stephanie. Along with being a producer with Dr. Stephanie, I'm also an actor, public speaker, and writer. I also consult on many different aspects of disability. I am an African American man with CP. I'm sitting in a power chair in my room that has a blue background, and I am on a gray short sleeve shirt.
We're excited to talk to you today about healthcare and disability because there are so many barriers people face as patients who are seeking healthcare. We have to find a provider in our insurance network who is taking new patients, who's located ideally a reasonable distance away from us, arrange for accessible transportation, or make sure there's accessible parking. And then we have to hope that the doctor is knowledgeable, compassionate, and can actually help us with our health concerns. So it's no mystery that healthcare is pretty inaccessible, and doctors, more often than not, can lack the knowledge of how to help people with disabilities navigate their healthcare needs.
I have a long history, as you might imagine, with medical care. I'm 40 years old, and over my course of needing medical care, I've had over 100 procedures and surgeries. It's been my experience that because of my disability, especially when I was younger, and it's gotten a little bit better as I'm older, the doctors or the staff will automatically go to my mom or my other caretakers because of my disability. I have to basically jump in and say, I can communicate or answer for myself. One time I was signing into the hospital, and the intake lady started asking questions, and each question she asked, like she was looking at my sister and expecting my sister to respond. I stepped in right away and I started responding to the questions. About 3 to 5 questions later, she was still looking at my sister, even though I answered every single question. And so my biggest barrier has been the fact that people don't think I can communicate, or they can communicate with me. On the good side of my healthcare, I have, been able across my journey to be with some really good doctors. One of my doctors in particular, over the course of 15 years, we really got to know each other, and he really got to know my body. So we had great rapport. So one time I went to the emergency room because my stomach was hurting really bad. I knew that I had a kidney stone. Long story short, they took an x-ray. They didn't see a kidney stone. My doctor just so happened to be in the hospital, and he came down to the emergency room, and he said, I don't see anything on the x-ray, but I trust you. So they set up the surgery, and lo and behold, it was actually a pretty big kidney stone. Sometimes it's difficult because of my anatomy and my spine curvature. It's hard to diagnose sometimes.
There are so many stories like that I'm sure we've all experienced to some degree, where there's an unnecessary barrier to quality of care and understanding and centering the person who needs healthcare the most. Doctors, they're doing their best. We still have a lot to learn about from the people that we're supposed to be taking care of. We go through a lot of school, 8 years of rigorous studying and going into debt, memorizing textbooks, regurgitating facts for tests. It's not entirely healthcare providers' fault if they don't enter the workforce fully prepared to provide disability-conscious healthcare. It's just not as widely embraced or accepted or highlighted in educational spaces. Unfortunately, that means ableism has been rampant throughout academia and healthcare, and knowledge about how to care for people with disabilities hasn't been accessible to doctors or healthcare providers. So it's important to make disability inclusion and advocacy accessible to the people working and training in healthcare. So we started making our videos to educate them. Today, we'd like to give you a little taste of the content on our channel, and we'd like to share some tips and tricks about how to make the most out of your time with your doctors when you do get that appointment scheduled and you're able to arrive at the facility or interface with a provider who might be able to help you. So let's go through our top 6 tips. Number 1, be mindful of time. Even if the doctor is running behind or late and they may not be able to spend as much time with you as you deserve or as you would like, the time that you do have, we're going to be mindful of it and try to make the most out of it.
Yeah, typically, like with an appointment, know exactly what you want to talk about, so you can get the appointment and you can feel like you were heard. I'm not trying to put anybody on blast, but my primary care doctor, now once I get in there, it's awesome. The office is very kind. He's a very kind gentleman, but you are a patient and you're gonna have to be patient. I've gotten calls before, like a robocall. They make sure that you're on time, but then you might be there for like 40 minutes to an hour.
Yeah, I definitely hear that. It's really frustrating when you're asked to come like 30 minutes before the appointment and then you're waiting 30 minutes after your appointment to be seen. Some of that is a systemic issue, like there's such a high demand placed on doctors to see a high volume of patients, and then that ends up straining their schedules, and then less people get sort of a full visit and a full evaluation that they deserve. So number 2 is introduce yourself and any access needs and goals of care right off the bat so that your goals and what you're interested in and what you need are very clear in the beginning. If you have a lot of complex history or details you need to parse out, try to consolidate it into maybe 2 or 3 bullet points about your access needs, what may help during the visit for you to get the most out of the visit, and what you're hoping to achieve by the end of the visit.
It really goes well when you can give those access needs. Also, if you know your history, that reassures the staff or makes them feel comfortable that they can get a handle on what you're coming in for, because not only have they read your file, but it's an extra reassurance that you know as well, and maybe you can emphasize something that's not in your file.
Absolutely. That's a really good point. Unfortunately, some of the reality is like sometimes doctors don't have time to read your file and they have no idea what you've been through up to that point, which is really frustrating. But a quick kind of summary and a clear statement about goals for the visit will help them get back on track and keep them focused on that.
I think they're more apt to listen to you and believe you if you communicate in that way, because they're like, well, you already know your stuff. You've been to this before and you're educating me a little bit, so maybe I should engage with you more.
It does make their job easier, although part of their job is to read your chart. So it's okay to hold doctors accountable to that too. So tip number 3 is rank your symptoms. Ranking your symptoms by number 1, the most bothersome or problematic that you want to talk about as the first thing that you discuss. That will give that important issue the most time. And then hopefully if you have time, you can say, okay, this is symptom or issue number 2. You can then talk about that. And then number 3, etc. That's going to save a lot of time and make things very efficient with your doctor.
And also in some cases that might help with the course of treatment. Like if you know that I've been to this before and this works and this doesn't work, or like I know I have experienced that a lot. Even in something as serious as a surgery, like I've informed doctors this certain procedure is not going to work for me. Here's what does work. Because sometimes a doctor's going to maybe mention a procedure or maybe a medicine that isn't going to work well for your case.
Yeah, exactly. And that plays into sort of statement of your goals too. If you're trying to like avoid surgery, for example, or minimize medication side effects, it's helpful for the doctor to know that up front so that when you are talking about your symptoms and what you need help with, they're not going to think about options that contradict your goals or aren't aligned with your goals. Okay, so that's a great segue into tip number 4. It's helpful to give the doctor what has helped and what hasn't helped in the past for your issues. In the doctor world, we call that aggravating and alleviating factors. So that might be medicines you've tried, therapies you've tried, different techniques. And again, this kind of helps them avoid thinking of offering you something that you know it has not been a good fit.
Yeah, a lot of times, like for example, before I met my doctor that I had such a long journey with, when I would have kidney stones, to break them up, they would use a shock radio wave therapy, but that would never work for me. As a matter of fact, they would do the surgery and the stones would remain and it would just grow. And over time, I learned that it was a lot better for me to use lithotripsy or something called a ureteroscope, because they could really get in there and break up the stone with a laser. Unfortunately, I had to find out like 3 times that it didn't work for me. Now I know, and I can inform the doctor.
That's a great example. You also told me a story about how, like morphine doesn't work. Like if you had to go to the emergency room and you had a lot of pain.
Yeah, I tell them right away, especially because when you go into the emergency room, for some reason, and I don't know why, morphine does not work for me. Sometimes I'm a little bit hesitant and I might be kind of nervous because I might have to tell the doctor that a particular medicine works for me, but it's the strongest medicine. And sometimes it's really awkward, or I'll just kind of joke off and play off like I'm not just trying to get high, or or just use the strong medication for no good reason, especially when the doctor comes in, because I know you can let the nurse know too, but it's when the doctor comes in, I let them know right away that morphine is not going to work for me. A Dilaudid is going to work for me.
I can see how you're trying to be considerate of like potential stigma and bias that can happen when someone seems to request a medicine that's kind of high risk or has a high abuse potential. It's great that you're considerate of it, and it sounds like you've gracefully been able to kind of put it lightly but still request what you need. And it's unfortunate that it sucks that stigma exists, and we have to face the reality of that and help providers understand that not everyone is drug seeking. Most people are not drug seeking, they're pain relief seeking.
Yeah, I'm sure you've encountered Dr. Stephanie, because that's something that we're really struggling with, because we may need stronger medications, but I think doctors nowadays, for good reasons. I'm not saying there are no good reasons, but I think we have to have a balance between trying to find the right medication, but really listening to those in the chronic pain community.
And that leads us nicely into our next tip. Tip number 5, you are the captain of the team and the doctor is your teammate. The dynamic should be more of a partnership where the doctor can help you kind of consolidate your symptoms and figure out maybe some root causes of issues that you're experiencing.
And make sure that when the doctor comes in, like Dr. Stephanie said, you are the captain. Make sure even though your spouse or your significant other or your sibling is in there, make sure that they are communicating with you and that you are at the center of the conversation. Yes, your loved ones are going to be helping you, but you need to be like, excuse me, Dr. So-and-so, I didn't hear that, or I didn't hear this, or so make sure that you are listened to, because as Dr. Stephanie said, you are the captain.
I usually tell patients actually that they're the boss and I work for them. And it's kind of lighthearted and joking. So I think more and more healthcare providers should be presented with that opportunity to guide and work for their patients. Finally, our last tip number 6, is ask for a simplified summary of the plan at the end of the visit. Request any sort of follow-up plan, like should you see each other again in 4 weeks, 3 months? It's helpful to have like a hard copy or a digital copy, whatever you prefer, of what you discussed during the visit, so you can always refer back to it in case there's any confusion, if there's a lot of things to remember. That is always a helpful thing. And it gets your doctor on the same page as well, because they understand, okay, when we do see each other again, what are the things that we were working on and the things that we decided to do.
If you are feeling uneasy about something, or if there's something that you want to ask your doctor, just know that you are in the right. You're not going to be bothering anybody, even though they may have an attitude or they're trying to rush you. It's very important to go with your gut and to be comfortable. Always know that you can ask questions. No question is stupid. It can be intimidating, but don't be scared to say what's in your gut. Like, for example, I was in the hospital for a significant number of days. They wanted to get me home because I was in there for so long. Me and my mom felt weird about me checking out, but the doctor insisted, and he was very nice. He was smiling. He was like, he's fine. So I was discharged. Well, I went home and I wasn't going to the bathroom, and I had a doctor's appointment. My doctor said in the appointment, you need to go to the emergency room. Now, luckily, the doctor's office that I was in the hospital that I was at. So I left our office and went to the emergency room.
Yeah, I appreciate you sharing that story, because that's a really tough situation to be in. Like you're kind of talking about, it can be really intimidating and overwhelming sometimes if someone who's very knowledgeable about medicine is telling you you're fine, but you don't feel fine. there's a weird power dynamic there that's hard to navigate. And it's not the easiest thing to say, you know what, I actually don't feel fine, or like, I think you might be missing something, or we should investigate something that I'm feeling. It takes that sort of self-advocacy to make doctors pay better attention to what your body is telling you.
Even if there's one person, like a doctor or a nurse, that you're still feeling uncomfortable, but they're the person in authority. So sometimes there may be a wall, but you can always go to a charge nurse or like another supervisor. Or in a lot of cases, a lot of hospitals have what they call patient advocates or liaisons. You can always go to someone else, because at the end of the day, it's about you and your health and also your comfortability. So just know you can even request another doctor. I know that's a little bit controversial, but you can.
Yeah, there's nothing wrong with that. Every good supportive doctor would encourage anyone seeking a second opinion to welcome that and embrace that, because doctors need to acknowledge that they don't know everything. And it's okay if you don't feel like the best fit with a certain provider. There are many others out there, and you deserve to feel like that's a good connection and a good relationship. With these 6 tips, maybe I'll just read them off one more time in summary. Tip 1, be mindful of time. Usually appointments are 30 minutes or less. Number 2, introduce yourself, any access needs, and your goals of care by the end of the appointment. Tip 3, rank your symptoms. Prioritize number 1, most bothersome, number 2, most bothersome thing. Try to condense your story around these symptoms. Tip 4, go into a little detail on what has helped in the past and what hasn't helped. This will guide your doctor to hopefully more effective strategies for your issues. Tip number 5, remember that you're the captain of the ship and the doctor's your teammate. Be encouraged to advocate for yourself and use your doctor as a guide to help you make decisions about your healthcare. And then finally, tip number 6, ask for a simplified summary of the plan, so you don't have to remember everything that you discussed and what next steps to take. And hopefully there's a follow-up that can be arranged to check in with progress. So with these tips, your healthcare providers will have fewer opportunities to impose bias, mistreatment, and dismissive behavior towards you. And they're more likely to consider you a human who needs help with a healthcare issue, which is what they're trained to do. If you're not getting through to your healthcare provider, like AJ said, we recommend seeking out other people on the healthcare team, like other specialists, support staff, patient advocates who can help you find a better fit. So thank you so much for joining us for this session and this wonderful conference. Shout out to Adriana Malazzi and Mariela Polino Peralta for organizing the A11Y conference. We're so happy to be here and be a part of this, and we're so happy to connect with all of you. If you're interested in helping healthcare providers learn more about how to make medicine more accessible to everybody, please continue these conversations with us on our YouTube channel. It's called Disability Clinic, where we teach disability-conscious healthcare education.
We want you to check us out and hit that like button and also subscribe. We would love for you to be a part of our community.
Thank you so much for watching, listening, and learning.
See
you next time.
I forgot what I was going to say.
Teaching healthcare professionals. Sorry. Maybe I should say the title one more time because I kind of forgot it. You want to say like and subscribe or whatever?
This is going on a blooper reel.
We break down movies and TV shows representing disability.
I am not ignoring your calls. It has been crazy busy.
You want to hear something funny, Dr. Stephanie?
Of course.
Ever since I turned on Siri, which was almost like maybe a year ago now, I'm telling you, I swear to God, she never read me my text before. Today is when she started.
Hallelujah. Siri is so funny. I'm very glad that capability is now with you. So let's celebrate that. We also have academic videos for healthcare students.
We also have healthcare videos for academic students. I don't know why I can't.
That sounded almost right. We also have academic videos for healthcare students.
We also have academic videos for healthcare students.
Yes, you got it. Nice work. Nice work.